Good day, everyone. You're welcome once more to House of Medicine, where we demystify the myths that surround medicine and give you facts about your health. Today, we'll be discussing LUTS in men, lower urinary tract symptoms, which we also call LUTS. Basically, what is LUTS? LUTS, like I mentioned, is lower urinary tract symptoms. And what is the lower urinary tract? This is the bladder, from the level of the bladder to the exterior, meaning all the way for men through the penile shaft where your urethra passes through, and for women through the urethra itself to the exterior. So all those diseases that may affect the bladder down to the exterior may manifest using these symptoms. What are the symptoms actually? There are a number of them, and we divide them into two. There's what we call the irritative symptoms, which is also referred to as storage symptoms. And these symptoms include what we call frequency, that is urinating often, urgency, a sensation where once you feel like urinating, you have this strong urge that if you do not rush to urinate, it might actually slip off from on your body. And then we have urgency incontinence, and in this case, you actually get to void on your body. That means pass urine on yourself before you're able to get to the point of emptying. And there is nocturia, what we call frequently waking up at night to pass urine. This is beyond what is normal for the individual. The other group of symptoms are also called voiding symptoms or obstructive symptoms. This includes weak stream. For children, they actually could pass their urine far from where they stand. But for men or elderly men with diseases that manifest with these symptoms, they find this urine unable to go far from them and drops close to them. We also have feeling of incomplete voiding, and in this case, the individual gets to pass urine but feels like there's urine still left in the bladder. We have what we call intermittency. Here, as the individual passes urine, it cuts off, comes back, cuts off, and comes back without the will of the individual passing the urine. We have what we call straining. Here, the individual has to push and apply some force using his abdominal wall muscles to be able to pass urine through and through. And then we also have what we call hesitancy. In hesitancy, once the individual goes to pass urine, there is this delay. Despite his will and urge, there is some delay before the urine eventually gets to come. Now, what could actually lead to these symptoms? A variety of things are a possible cause, ranging from children to adult men to elderly men. In children, a number of diseases like stones in the urinary tract, or a disease which children are born with, which we call posterior urethral valve, could all lead to these symptoms. But in men, which is the focus of our discussion today, also a number of diseases could be linked to it. These also include things like stone in the bladder or within the urethra. The urethra is that channel or passage from the bladder where the urine is stored to the exterior. And also things like what we call urethral stricture. Urethral stricture is more or less scar tissue formation within this urethra, this channel that links the bladder to the exterior. Also, in middle-aged men, prostate disease, most especially benign prostatic hyperplasia, is one of the commonest causes in them. And in elderly men, in addition to benign prostatic hyperplasia, things like prostate cancer can cause it. So why are we discussing this? Basically, we are bringing this to your notice so that once you notice any of the symptoms, don't hesitate to seek out a urologist for treatment. So, in all ages, there are also other causes. Infections, which we term urinary tract infections. Diseases like diabetes mellitus can all mimic these symptoms. So this is how much of importance these symptoms are, because they could be a pointer to a wide variety of diseases. It's very important you seek help from a professional as soon as you develop them. Thank you once more for tuning into House of Medicine. I remain a urologist. Remember, we make women happy by keeping men healthy. Thank you.